What keeps a coordinator on her game is clear expectations, defined numbers, regular review, and coaching feedback. Not micromanagement, not pressure, just professional accountability. What surgeons often miss about coordinators is the fact that they can either stabilize your revenue or quietly sabotage it. Not intentionally, not maliciously, but simply because this role is far more complex than most practices realize. Many practices believe if she's friendly, organized, and experienced, she'll convert. But what actually happens is this: the coordinator's pleasant, patients like her, consults feel smooth, and yet patients hesitate, they don't commit, they disappear after the consult. And you're left wondering, is it the leads? Is it the price? Is it the economy? Most of the time, it's none of those. It's that the coordinator was never trained to guide an emotional decision. Cosmetic patients don't need more information as much as they need certainty. And certainty doesn't happen accidentally. A trained coordinator understands that her role is to represent you as the obvious choice, make the patient feel emotionally safe, discover what actually matters to the patient, handle resistance without pressure, and confidently ask for the decision. Now that requires mindset, structure, language, timing, and practice. Now without training, coordinators default to over-explaining, avoiding uncomfortable questions, accepting "I need to think about it" too quickly, or waiting for patients to decide on their own. But patients don't want to be left alone with uncertainty. They want guidance. This is where many good coordinators struggle. They care, but they don't want to pressure anyone. They don't want to feel salesy, so they hesitate to lead. But here's the truth. Helping a patient decide is not pressure. Avoiding the decision is what creates anxiety. Now, when a coordinator is trained properly, she learns how to ask questions that help patients clarify their own reasons, address fear without dismissing it, reframe objections instead of accepting them at face value, and move the conversation forward ethically. That's not personality, that's training. Because even strong coordinators drift without structure. They get busy, they multitask, they stop following up consistently, they rely on memory instead of metrics. That's why training alone isn't enough. What keeps a coordinator on her game is clear expectations, defined numbers, regular review, and coaching feedback. Not micromanagement, not pressure, just professional accountability. When coordinators know their consult numbers are tracked, their conversions are reviewed, their follow-up is measured, their numbers improve. Not because they're afraid, but because they finally know what success looks like. Now, at a minimum, every coordinator should know how many consults they had, how many converted, what patients didn't move forward and why, and what follow-up is pending. Now, without this, improvement is impossible. You can't coach what you don't measure, and you can't expect growth without feedback. What I do is take the coordinator you already have, or the one you're about to bring on, and train her to operate at a professional level. That means teaching conversion psychology, providing structure and language, coaching decision-making conversations, and holding her accountable to measurable improvement. So she represents you with confidence, so patients feel guided, not pressured, so your consults turn into booked procedures more consistently. So if your coordinator is kind, capable, and motivated, but you know she could be converting more often, that's not a hiring problem. It's a training and accountability problem, and it's fixable. If this resonates with you, check out convertingacademy.com to give your coordinator the structure, skills, and accountability they need to book more surgery for you.